Hi there. So I just wanted to take a little bit of time to explain why I have closed my clinic already. So Birchington Osteopathic Clinic is shut for as long as who knows at the moment. But I'm not seeing any patients either in clinic, no home visits, not at the studio. At the moment, nothing at all. This is despite the fact that the General Osteopathic Council have still given no guidance at all regarding this outbreak. One way or another, they're not saying, oh, definitely carry on, or oh no, you've got to stop. It's just you make your judgment call based on what you think regarding all the information that's out there about the virus. It means that there are a lot of osteopaths who are still practicing. I'm not sure about the local Thanet ones, I've not looked yet. But yeah, because we've had no definite you must close from GOSC, there are osteopaths who are still open. I personally don't agree with that. I think we should be now closed, but these are my reasons for that. Let's just start off. So because of where my clinic is in Birchington, I do have a higher number of clients who are in the 70 plus category, or who are, you know, getting closer to that age. And government advice has been for over a week now to, you know, that people in the 70 plus category must be self-isolating. So, you know, you're looking at, unfortunately, staying at home away from other people for, they're saying 12 weeks, so 3 months, unfortunately. But like I say, because I have a large number of clients who fall into that category, then, you know, that's one reason why I'm closed, because I don't want to be, you know, encouraging people to come and see me when they, you know, they should be isolating themselves at home. So that's one. Another thing, if we look at the suggestion that if you're spending sort of 15 minutes with someone within 2 meters of them, there is a significant risk of passing on this virus. And my appointments are a minimum of 30 minutes, and we are most definitely going to be closer than 2 meters within that time. So, you know, just in that time frame, you've got a significant increase in risk of passing on anything that, you know, may be present within either person. So yes, you know, it's been suggested that I could do shorter appointments. For me personally, I don't feel that I can provide an effective osteopathic treatment session. So that's consultation, treatment, or an examination treatment, and then aftercare advice within 15 minutes. It's not how I work. I don't think that reducing my appointment slots down would give, you know, my clients the effective osteopathic treatment that they're used to from me. I don't want to sort of give a less level of care. So, you know, again, for that reason, I don't want to shorten my appointments. I don't feel it would be worthwhile to people coming to see me. So there's that. Let me think what else. Okay, so I'm not a disease prevention expert. I've, you know, done no study in that field at all. And that's where all the advice that's coming down from government, they're getting it from people who that is their job. For me, I've been following, you know, I've always washed my hands between every client that I see anyway. I've increased the cleaning protocols in between my appointments. So, you know, one, I've gotten rid of all the soft furnishings that we normally have. So like the couch covers, you know, my soft pillows that, you know, can't take the covers off. You know, I've not been using those. And I've been sort of sterilising the plinth, the couch, between each person with, you know, I've been using a very high content alcohol cleaning solution that's been recommended as being effective against this virus. I've been sterilising all the surfaces that other people have been touching, so think door handles, you know, my desk, any of the bits and pieces in the waiting room. However, you know, I can't access the sort of personal protective equipment that is completely effective against spreading this virus and any other ones that might be floating around. But you know, so I can't access that sort of equipment, and you know, that's the only way that you can completely sort of stop or help to stop the spread. So again, you know, think about the treatment when you're up close and personal with you know your osteopath, or you know, my patients or whatever. You know, there's sort of no barrier between us. So you know, without sort of effective equipment against spreading disease, you know, again, I don't think it is right or safe to continue treating for. So you know, that's another reason. I had one other that I thought about. Oh yeah, so at the end of the day, we don't know who is carrying this and who isn't. So, you know, they're talking about, you know, it can be in your system for up to 14 days before you even realise you've got it. Some people are completely asymptomatic. They've got no signs that they're currently carrying, you know, COVID-19. So, you know, again, I can't tell if sort of my clients have got it, they can't tell if I've got it, I've got no idea if I've got it. As far as I'm aware, I've not been in contact with anybody who has later presented with the symptoms of it. But again, because of that sort of 14-day period, we can't be sure at this point anymore. So again, it is safer to, you know, follow the guidance and to distance. Just to kind of put things in perspective, so I treat for, you know, a 5-hour block. Within that 5 hours, I'm going to see up to 10 people. Now, that's one of me, 10 people. If each of those people that I've worked with then goes and has contact of, you know, again, if we just take the 15 minutes within 2 meters of, you know, then 5 other people. So one of me, my 10 clients, and then they each see 5 other people. That's then 50 people that have potentially come into contact with something if one of us doesn't know that we're carrying it. That's how these things then spread. So just from, like, for example, you know, just from one day of treating my usual client list, anything could spread through sort of that chain, and it just gets wider spread from there. So that's kind of, you know, where I was anyway. So sort of middle of last week, I was already considering that I needed to close. And then obviously we got to Friday and the Prime Minister announced that all non-essential businesses need to be shut. Yes, he only mentioned sort of leisure facilities on, you know, when he was doing his address, and someone, you know, it's been queried, oh, why do you need to close if, you know, he's only mentioned leisure facilities. Actually, if you go down and read the guidance, it says, one of them, it says wellness centres. So I know there's some osteopaths who would take offence at being put into the, you know, the same category as, you know, like a spa or other non-health care related facility. But for me, you know, I think that was pretty clear. You know, I would think that what I do falls into the wellness category. So, you know, there is that. It's also been asked, well, oh, you know, no, your healthcare, surely you can carry on. You know, your again, it's that term non-essential. Okay, unfortunately, I am a non-essential service. I'm sure to my clients that I've helped, you know, they would probably see me as pretty essential when they're in a lot of pain, and then they come and see me and they go out feeling better than when they came in. However, if you look at the, you know, non-essential being, you know, yes, you might have to stay in pain a little bit longer, but you know, you're not going to lose your life by not coming to see me, or, you know, those like me. So in that sense, you know, I'm not an essential healthcare service at this point in time. There's other things that are way more essential, sort of than you know, than what I'm doing. And you know, it's those establishments and people who are going to be helping to, you know, they're going to be the ones supporting or treating, you know, people who do come, you know, do present with this infection, and they have it at the, you know, the worst end of the scale. So what I do, you know, it's not on the same league as that. So, you know, that is again sort of where we are now. So let me think. So just in this time, you can't come and see me, but I am still at the end of the phone. You can still call. We can discuss through symptoms. So if you know you've tweaked your back, your neck, whatever, you know, I'm still happy to talk, to advise over the phone. I will be doing on sort of my social media channels, so Instagram, Facebook. I will have, you know, just little hints and tips, because everyone should be at home, self-isolating, working from home. We're going to look at things that we can all do at home, setting up your workstations correctly, basically maintaining your body health, you know, while we can't get out and see people like myself. So yeah, jump on Facebook, jump on Instagram, come and have a look. I'll pop in as much content as I can kind of come up with, just to sort of assist through this period. So, you know, come and have a look. And, you know, don't think that just because we are isolating, we should not be isolated, okay? You know, there's still people at the end of the phone. We've got, you know, we can even do like face-to-face consultations. I'm quite happy to do that. Please don't be alone in this time, okay? All right. Thanks, everybody. Stay safe.